to Solutions for Aesthetics by APAN. This is a program that will be introducing some very interesting topics, educational and inspirational topics on all things aesthetics. Today we have the privilege of having Gay Wardle with us to introduce a very interesting topic. She's very well educated and resourceful, and if you want to know further information, click below and you'll get her full profile because she's an amazing lady. But today what we want to cover is in terms of qualifications, Gay's got a diploma in beauty therapy, but she's also moved and she's completed a degree qualification in aesthetics. And what we want to ask you, Gay, is how has your knowledge changed the way you've addressed skin conditions and improved your treatment outcomes, especially with more difficult skin conditions?
Thank you, Tina. It's a pleasure to be here. So asking that question, gosh, it takes me back to a long time now when I actually did my degree, but I certainly do look at skin a whole lot differently to what I ever used to before I did the degree. And I think one thing is when I do my consultation is to be, it's very critical about looking at skin and understanding superficially,
internally and
what's going on with the body as a whole, looking at the 7 systems. And one of the things that I like to really understand is not only the digestive system, which is really important, but the pulmonary system, because I think that's really has a huge impact and something we kind of overlook as a beauty therapist. We don't kind of think about that so much. But to me, that is part of the circulatory system that is so important to understand how are we getting oxygen through the body. Really important. And then understanding the nervous system. When people age, looking at the skeletal system is really important because that part of the body ages first, but we don't realise it.
Well, for the face, it would, if the bone structure ages, it would automatically create ptosis of the muscles and the skin, and really, it helps us understand, even if we have a facelift, we're not going to turn out to be the way we were before because all the bones have moved.
Absolutely. The bone structure is really a really critical part of ageing. But the other thing that I guess I look at too is how do I put my treatments together? And that's a really important part. We can't just diagnose a skin and then write a program of, say, 12, 14, 15 different treatments and think that's going to be the pathway we're putting this patient on, because it doesn't actually work that way. Each time a patient comes into the clinic, you need to sit down and do an evaluation on how their skin has progressed from the last treatment. What is actually going on with them? What changes have they noticed? And for me, I can't book someone in I book people in definitely for a 12, 13-week program, but I will always say to them, I'm going to put in a treatment here, but we probably won't be doing that treatment. I'll actually have a look at your skin and we'll take it from that consultation on the next visit.
So you're retaining a level of flexibility because what you're doing is you're observing the skin's response to the treatment, and that's dictating what you're going to do next. That's why there's a level of unknown, correct?
Absolutely. You can't be rigid.
No.
When you're doing your treatments.
You can when all you've done is learnt from a diploma level where you've just learnt policies and procedures and protocols, so you determine, so bang, 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 I'm going to do these treatments, so you mechanically do them. But it seems that the more we understand the body with knowledge, it gives us the ability to understand the changes that we're creating. So are you saying that by allowing the body to speak to you in terms of how it's responding, is it possible that you can totally change your path of how you're going to treat it?
Absolutely. You do change your path on how you're going to treat it, because the skin will respond to the treatments that you put topically or do topically and what the applications of the actives are to that skin. But it's also going to respond to what you do internally. Yeah. And I think that's really important to actually understand that. And understanding, the digestive system. We've been talking about that for years, how important that is, the impact that it has on the skin. But to me, understanding hormones as well. Now, hormones is such a large area, and we can't really, we're not endocrinologists, so we can't really understand the impact all hormones have on each other. But I think there's certain things that we can pick up on, and that's anxiety, stress, where we actually will know that there's certain hormones that are actually elevated, and they can have an impact on other hormones such as your AMSH, your melanin stimulating hormone, that can actually trigger off a pigmentation change to the skin. Correct. You've also got FSH, follicular stimulating hormone, and then you've got to look at the sex hormones, yes. How they impact as both males and females go through their years, go through the ages, and those hormones will naturally change, and we can't change that. We can't stop that from happening. But the impact that those changes have on the skin is massive. And I think understanding that, and I think the degree program taught me to think that way, whereas I probably would never have thought about that, when I was just doing my normal beauty.
It would make your work more interesting, wouldn't it?
Oh,
there's no such thing as just routine.
It's wonderful, and you can't have a script for a consultation either, because every consultation that you do is unique, it's different. So to me, you find out certain aspects of that person, like their medical history, that's what everyone would do and normal, but the rest of it is around a conversation on what is happening in their life. And to me, there's 3 steps to this, and that's
now,
one.
That is a good point. That's a good point. So in other words, you're saying that you have a conversation with a person about their life. How can that uncover, give me an example of what it could uncover that possibly it wasn't in the consultation form?
Absolutely. So the environment that they might be working in, living in, will have a huge impact. What they do, what is their recreational like? What is when they go home? What is their home life like? Often when you talk to people about their levels of stress, I want to find out, is your stress worse at home or is it worse at work? That's really important, because stress can be different for different people at different times of the day and wherever they are. So, children, how exhausted are they? If they've got young children, how are they actually looking after themselves so they don't get so tired and they're not able to cope with, it's too hard for me to put a moisturiser on tonight because I'm just so hard. It's just so hard. I haven't got time. I'm too tired. So just understanding that is really important.
So I want to ask you something about inflammation. How do you determine if the body has above average inflammatory condition, and how would you treat that?
So inflammation is it's so different for everybody as well. So I'll give you a perfect example. A young girl had some sinus issues. So she wanted some pigmentation treatments done on her face, just a couple of spots on her face, but she also wanted to have a small tattoo removed on her shoulder. So it doesn't seem like a lot of work. It's just a couple of spots to remove a couple of pigmentation spots and a very small test patch on this tattoo. But the next day, that person was so unwell because their body was already inflamed. Right. There was already internal inflammation. So to create that external inflammation just added to that. So I think it's really important that we understand that when people come in, that we can't just take it for granted they've got a sniffly nose. It's not going to, we can still do this treatment. We have to really understand, how are they feeling? And that's a really important thing, I think, going through the consultation. At this moment, at this time, how are you feeling? Because the treatment that I'm going to do is going to create more inflammation. So we need to be really careful that we don't create too much where your body just isn't going to cope. And the size of the person is going to depend on that as well. You get a tiny little person that is not unwell, they're going to have more inflammation than someone who may be a little bit larger.
You know what I found? I found a lot of people were ringing me and saying, I have done advanced peels, or I've done procedures where normally I've followed everything correctly, yet that person's reacted so badly and I don't know why. And yet I did it last week and they were fine. So do you believe that with the stresses of COVID, that we can get delayed responses, delayed reactions, where the body can indicate that collectively with what you're trying to correct, where you're changing, interfering with the nervous system, that it can inflame or create a delayed inflamed response?
I absolutely do believe that. And there's a couple of aspects to that. So one, the person is probably feeling a little bit anxious, a little bit stressed about the situation that COVID has put them under. And then there's other health aspects as well, where people are forced to wear masks and are forced to stay inside, indoors. And so then we've got to look at things like pollution. And indoor pollution can be accelerated far more than outdoor pollution in some areas. So you've got to have a look at exactly everything that's going on in that person's life. And if you do a peel on somebody that, yes, they might have had a great result one week, but the next week, not so good. So what's happening to them? What's changing their barrier function that actually is allowing that peel to be more aggressive?
Correct.
So we've got to think about those.
The protective barrier has been compromised.
Absolutely. Where is the pH of that skin? So you can use a peel one week and be fine. The next week, the same peel on the same skin, not change anything that you're doing.
So you're just saying that if you look at the person as if you're looking at them for the first time in the second visit, and you looked at what's happened during the week, what you planned, you may change that because you can identify the skin can't cope with it, correct?
Absolutely.
Especially with corrective work.
Absolutely, it's so important. It's so important that evaluation, each visit that they come in, is really critical to the outcome of the treatment.
The other thing I was going to ask you is how much have consumers changed in, say, the last decade in terms of what they expect to get from you? Are they comparing, because there's a lot of injectables being promoted, do they expect you to make changes that really challenge your ability to deliver, or are a lot of people still happy just to have a lovely relaxing treatment?
No, people now are wanting to have something that's going to change their skin. And they are opting to have injectables, they're opting to have surgery. Just today I had a woman come into my clinic and she was actually looking at having cosmetic surgery. She was actually looking at having a facelift. Skin wasn't really that bad to have a facelift. She had some pigmentation. There was a bit of black skin there. But when I went through the options of what we can actually do in the stages, like we have stage 1, stage 2, stage 3, and we weighed up what the trauma would be for her to have a facelift and the cost, we could actually deliver a pretty good result that she would be very happy with, without having to go down that pathway. And I think one thing that I've noticed with people that are having a lot of injectables and things like that is that they still don't, if they're not looking after their skin, they can still look not great because they've got these hyaluronic acid fillers in their skin, but they've still got pigment showing on their skin. So, if you really want to look amazing, we've got to clear that up first. Correct. And then work with the injectables. So I think it's a time that we actually are now working with injectors more than we ever have done. I have injectors coming to my clinic, and I think it's really understanding the client and getting the client prepped, and that's what we do. Your injector's coming, this is what you're going to be having with them. Let's do some treatments to actually start to clean your skin, get your skin clear, get a little bit more plump, increase the collagen, increase the elastin. Let's get it hydrated so those fillers are going to last for you. So I think it's really important that we understand the different types of fillers out there, and you work with the injectors in a really in a way where you can actually get value for the clients. And I guess I learnt that when I did my degree as well, understanding the different types of injectable fillers, though they change from year to year to year. They're changing all the time.
So many now. There's over 30, I believe. But it's interesting. there is no doubt. I remember one conference that we went to, that a medical conference where they talked about youthful skin, and they said a youthful skin is blemish free, it has no pigmentation, it's plump, and the pores are very refined. So they said those changes only happen with skin treatments. They don't happen with necessarily with just injectables. So they stress the importance, even with cosmetic medicine now, skin and looking after skin is the number one priority. So thank you so much, Gay. We've really enjoyed having you, and I hope that our audience gained some knowledge and some few tips from what Gay was sharing in terms of how education can really change your perspective, and it is an exciting thing. It opens new horizons. So thank you so much, and we look forward to seeing you again next time. If you're not joining our channel, would you please subscribe down below and click on that so that we can notify you when we have another program. And thank you so much, and may you all have a lovely day. Thanks.